Hello and welcome to the participants. Um, and this session will be looking at a particular aspect, a new aspect of openIMIS around the newly formed Catalytic Implementation Fund. We've had many AHIN hours before looking into implementation experiences as well as the functionality of openIMIS. While we'll do a brief overview of those functionalities and together with some updates now, our main focus in this session is to introduce you to the Catalytic Implementation Fund of openIMIS and yeah, also if there answer any questions and also encourage various scheme operators or supporters of scheme operators to look into it and take advantage of it. But before we get into that, just to set the stage, we'll go through some of the basics of openIMIS. So, as many of you would already know, health financing schemes, social protection schemes are very complex. They have multiple business processes within them that, unless they are efficiently handled, the sustainability of the scheme itself becomes a question. So it is highly important to implement these complex business processes in an efficient manner. However, the scheme operators in low and middle income countries really struggle to have access to appropriate digital technologies that can help achieving this efficiency. So I think everyone is in agreement that the digital technologies can help in achieving these efficiencies, but that also just having access to digital technologies, appropriate ones, it is not very easy. We've seen institutions go down the road of building their own IT system. Only this morning, I was talking to representatives in a country who's designing a new social health protection system, and their idea was to, in their words, design a simple system to start off the social health insurance. And this thinking really is leads us down to a path where it becomes difficult to manage the system, right? So a simple system quickly turns into a more complicated system, and then it inevitably becomes the one that hampers the success of the scheme. The other option is to buy commercial, but similar to building an own IT system where you have a lot of costs, commercial is even more, right? So you have two costs to bear in mind. One is the initial cost of procurement of the commercial system, and the second is the vendor locked in maintenance cost that comes in every year. Not to say that other systems don't have the maintenance cost. Of course, maintenance costs are required for each IT system, but the problem with commercial ones is that a vendor lock-in is created, and there's no competition for providing the maintenance support. And the last option is to use open source, and that's the the option that we are exploring with openIMIS, particularly since there's a lot of knowledge around building own IT systems in various countries. So in a nutshell, openIMIS is an open source software for managing various health financing as well as social protection processes. And we don't stop at just being a software, but we are actively developing and supporting a community of practice around software developers, users of the software, and then the implementers. And the joint mission is to increase and improve access to universal health coverage as well as universal social protection. So as you can see, we are shifting gears a little bit to also look at use cases for universal social protection, and we'll get into that in a minute. Where openIMIS is used right now, in Asia, Nepal remains the one and only country where it is used. The scheme there is growing. By the end of this year, we hope to have 100% geographic coverage of the scheme, and thus the use of openIMIS, covering the population. We're looking at over 4 million beneficiaries registered with using openIMIS there, and it's continuing to grow. In Africa, the core countries where it started in Tanzania and then in Cameroon continue to use openIMIS, and in Cameroon it's even growing to newer schemes. In Tanzania, it is growing to a new scheme in Zanzibar through a different implementer. So it's growing in the existing countries. Chad and DRC, where there have been small pilots, remain using openIMIS, and we are quite excited to continue the usage there. Um, New pilots are being designed and tested in Djibouti for the national health insurance there. And another use case that is quite new and very interesting is in the Gambia, where openIMIS has been used to manage not a health financing scheme, but a more social cash transfer scheme. So the group in Gambia, working together with the government of Gambia and the World Bank for a cash transfer scheme, has customized openIMIS to manage processes for that. So beyond health as well. Um, the core workflows that are supported by openIMIS, I know a lot of us are already aware of this, but still is one enrollment, and this we're slowly growing the functionalities here, so you can enroll households or individuals in using openIMIS, but now very recently also the ability to work with the formal sector, so to register people or families together with their employers and maintain an employer-employee relationship. This is a very new functionality coming to openIMIS, and we hope to launch it in the next few months. But we're very excited about it. It provides a completely new realm to openIMIS usage, which was limited to the informal sector so far. But with this new module, we are really looking to expand to schemes that are that focus more on the formal sector as well. Of course, you can use a mix of digital and paper techniques for this enrollment, depending on the communication internet availability scenario. You can record the contributions and all the different aspects related to enrollment here as well. And beyond enrollment, the renewals and change of family or a change of individuals are also fully possible using the enrollment module. The health service module, or we can think of it widely as just a service provision, keeping track of services provided module, is starting from allowing a service provider, so in this case a health facility, or also when we're looking at cases beyond, so any other social protection service provider can use openIMIS to ascertain validity of their scheme membership. So are they enrolled or not? Do they have an active policy or not? Starting with that to allowing recording of services provided. So in the health case, recording of medical services provided, recording of the diagnoses using ICD-10, recording of the drugs provided. All of that can be done. And in use cases where there are already electronic medical record systems in the health facility, openIMIS can just interoperate with those and receive data directly as well. And all of that, it accumulates into uh, a claim which can be entered and sent into to the payer in a health insurer or any other scheme operator, so that these claims can be reviewed. So these claims, once they are submitted, they go through some automated checks. So basically a rules engine looking through if certain aspects of the claim that are just self-evident in terms of, let's say, for example, a pregnancy being claimed for a male patient. We all know that is not possible, so the system would just reject it automatically. And there are other rules that you can apply as per the need of the scheme. And beyond that, it would come to a claims review, a manual claims review, where a medical personnel can look at the claim and adjudicate if it's okay or not, and then ultimately leading to a payment approval for health facilities. And as you can see, all of in processes 1, 2, and 3, we will be dealing with a lot of data. So openIMIS has a monitoring and reporting tool, starting with like simple static reports that can be generated for certain timeframes, to an analytics engine. And for the analytics engine, we have basically built interoperability with DHIS2, so that we didn't have to build our own analytics engine. So we just used the capabilities of DHIS2 and built interoperability between openIMIS and DHIS2 to exchange the data and actually have analysis of the various aspects of data collected in process 1, 2, and 3. And something that's coming out in April this year is an artificial intelligence-based claims adjudication module, which will help the manual claim reviewers. So when the number of claims really increases, it becomes very difficult for manual claim reviewers to adjudicate on, if not all, even a majority of them. So they need support. One of the ways in supporting is to just add more claim reviewers to the team. But we also understand that this is not an easy task to do for our health insurance operators or payers. So we're developing a module that will help to ease the problem, right? So it won't solve it completely, but it would help. It will look at the decisions made by the claim reviewers manually in the past, and then provide some advice moving forward. So we're really excited about building this forward, and we're developing it in a way that the module can be used even if you're not using openIMIS for the other processes. So if you have a system where you would want to use an AI-based claims adjudication, please do keep in mind that openIMIS will have this functionality and that it can be interoperated with other systems. So now that we've looked at all these functionalities, we can just briefly go through some of the use cases that we think are important. The managing health insurance, I think this is pretty straightforward. We've looked at that as an example. So openIMIS does both formal sector and informal sector, could potentially even be looked at for the private sector, and all these functions are available in terms of beneficiary management and claims. I would like to stress here that there is offline functionality in openIMIS through the use of apps on Android. This doesn't mean that openIMIS will run fully offline, but it's more for cases where we have intermittent connectivity. So even if you don't have connectivity, you can still enter a claim through the app, and once you do get connected, you can send all those through. So things like this are possible in the offline functions. Beyond health insurance, as I said, openIMIS works for other health financing schemes as well. So managing voucher schemes is also an example. So this is easily possible using openIMIS. You can create digital vouchers for, let's say, for maternal health, like antenatal care or postnatal care visits, and you can limit how many visits a person can do per year or per registration. So effectively creating a voucher-like system so that once they receive the services, they can't receive the same services again. And thus you would also be keeping track of these vouchers. And of course, the online, offline functionality exists as well. Now, looking a little bit beyond health, we have an implementation in Nepal on an employment injury insurance scheme or an accident insurance. So it's being used by the Social Security Fund in Nepal, where they are using openIMIS to do to the regular things in terms of registering beneficiaries. But here, since they already had a beneficiary management system, they're just using the interoperability functionality in openIMIS and linking with their existing system. New modules have been developed for reporting an accident, something that wasn't there previously in openIMIS. Medical claims processing, that always existed in openIMIS, so that module is just used as it is from a health financing module. And then also new functionality has been added to classification of the accident. So someone reviews it and classifies accidents according to severity. The same with disability level as well. And then which ultimately gets linked to salary compensation. So these functionalities have already been built in openIMIS and are available for other scheme operators to use as well. As I've been mentioning before, openIMIS has also been used for cash transfer schemes. So basically the same, again, the same functionality, use registering beneficiaries, providing them with a unique ID, keeping track of services provided. So here, instead of health services, it's cash payments that are being tracked, generating a payroll for every payment cycle, in terms of who needs to be paid what amount, sending that to the payment authority, and also using Android apps to for collecting some data in terms of um, in terms of assessing the efficiency of the system. So even to collect feedback from beneficiaries. So with those use cases behind us, those that should give you an idea of where openIMIS can be used. And I hope it also helps to explain that it is feasible to look at openIMIS beyond just health insurance and even beyond the health sector. So I would really encourage you to look into that a little bit further. But now we want to get in how the Catalytic Implementation Fund can really support. Um, so in the past few years, since the openIMIS initiative has been working, one of the things that we have not only realized but felt is that, of course, the software and the knowledge around it is free. The software you can download right now, the knowledge on the wiki, on the website, just approaching us or the wider community, that's always available to everyone. But there's still a problem in terms of even having all of that for free, getting started with, it's a problem to get started for some scheme operators because they don't have some initial seed funding, let's say, that's required for just customizing the software according to the specific needs, maybe some hardware, and also the training of various users. As if you employ openIMIS, you really need to, you will have a lot of people interacting with the system and you need to train them. So the lack of funds to cover this initial implementation are, we have seen as being a barrier for increased uptake of openIMIS. So BMZ and STC, so the German and Swiss governments, have jointly set up what we call the Catalytic Implementation Fund for supporting these implementations. So it's an answer to this problem that we have seen. These are funds that are available to help countries with getting started with openIMIS, and it is aimed to be catalytic in nature, as in it's not intended to be a funding stream that will continue where you create a project on openIMIS and you just support the implementation through it. It's on the contrary, it's more like the fund can get you started, it gets the software customized, it gets an initial group of users trained, but then there needs to be other mechanisms to continue continue the implementation. So it's not intended to be a continuous funding stream, and thus the sustainability of the use case is of high importance and priority to the donors. So they really want to see, okay, if the implementation fund is used to start the implementation, what measures do we have to make sure that it is a sustainable implementation? And we're looking at partners partners in countries where there is German and Swiss development cooperation, but that's not a very strict aspect. We are open to looking at other examples as well, and but if it's a BMZ and STC country, I guess that's the most that's an easy way in. With that, I would hand over to Constanze to take us through the eligibility and the other aspects of the Catalytic Implementation Fund.
Okay, thanks, Sorf. So far, yeah, so who would be eligible eventually to apply for support out of this Catalytic Implementation Fund? It's the scheme operator. So do we have cases where actually the developing company contacts us, as was the case, for instance, for Gambia on the cash transfer? It's eventually the scheme operator that would go through a consultation process with us and through this application, so to say, for the fund support. Yeah, scheme operators from the background of health financing or social protection schemes. I think this the use cases that were portrayed before give you an image of where this could fit in. You might, but also, yeah, just might contact us, finding out, is the scheme you're working with the one that fits in here? Yeah, the clear definition of the scheme, I think we emphasize this as different points already, is important, because eventually the customization of the software really needs to follow the clear requirements, and the requirements of the scheme are, so to say, laid out when you have the legal or the policy framework in place, and when standard operation procedures are already defined, so that you don't start from the scratch again if things on that side change. Yeah, what can the fund eventually be used for? The major share is, though, in that frame of a catalytic support only, probably for the software customization. But you might have also the case of maybe an existing pilot of openIMIS used, and then you want to scale up the whole thing, like extend the scheme to different regions. There would also be maybe majorly capacity development needed. So we had the point of the training for users. So this is in the initial phase of starting with a pilot. It's important, but then also for just going up in scale. And to a minor extent, we would also talk about support to equipment, but that should be really just a side effect. Again, looking at in what way is the whole thing sustainable. Equipment probably is something that needs to be covered by the funding that you put in setting up that scheme anyway. Okay, then moving over to explaining the process. There are majorly two steps, so to say, for us to consult with BMZ STC on what can be funded, and that would be the stage of do we investing in the initial feasibility study, and then at the next step when the decision goes for yes, we go in with a feasibility study, we prove that openIMIS is the right tool, and we have the scope of what customization would be needed for the implementation. to then decide on the implementation. So this is just the perspective of where do we consult eventually with those deciding of using the support from these funds. But from the side of the scheme operator applying for it, our first point to come together is on the expression of interest. Let me just share a link with you. We have a wiki page where the whole process is also explained, and there you find also this form, expression of interest. This is for us, so to say, the basis of collecting information of is there either already a history of working with openIMIS, which, as we saw in the case, for instance, of Cameroon, several schemes had been worked at with openIMIS. So we look at this, but it's not a precondition. So if in a country openIMIS is applied for the first time, then it's more about describing the scheme, then mentioning or explaining the standard operation procedures that had been defined so far, giving background on this legal framework, and also orientation on what is the scale of scheme that we are talking about here. Yeah, so this is maybe the geographic reach, the number of beneficiaries that we have in mind, and what is their profile. So with this, we then go into a consultation, with the commissioners, BMZ, SDC. From our side, at the coordination desk, after intensive consultation with the scheme operator, we can also add a price tag. So what do we think is here the investment for the first stage in the feasibility study? And what is the partner structure? Do we maybe have either programs by BMZ or SDC in the country that we can work on, like having a better reach also on the consultation at place? And what is the environment, digital environment, so to say? What interoperability requirements going to come up? So with that, the commissioners can decide, okay, we go into a feasibility study where then more detailed information would be collected. So that means like you need to include more information on what is the prospective impact of employing openIMIS in that scheme. Again, going to the profile of beneficiaries, giving more detailed information also on what would be, for instance, the share of women benefiting from this, or the share of the poor population. What would be partnerships possible in this context? So as we said, the funding is a catalytic funding. So what are the other sources, so to say, for the long-term investment in that scheme? Are there co-funders involved? Is there also what is the prospect also of the implementers, users, developers in that specific implementation to join the community? As we say, openIMIS is not just a product, but it's also the community sharing knowledge, experiences on the individual implementations. With this additional information, then we can go back again in the consultation with the commissioners, and then it's going to be decided on do we enter into implementation? Is there additional funding for the implementation? And as we pointed out before, this can be done on going into the customization in the capacity development, or as we said, like to a rather minor extent for the equipment itself. So we can at that stage still define really clearly what are the terms of reference, so to say, for the implementation. Okay, that's maybe all on the process.
Thank you, Constanze. And maybe just to add one last point here is once it is approved and the support provision is there, the way it would be done is it will most likely be an offer, like you would have a technical assistance agency providing the support. It would be unlikely that we have direct cash grants to the scheme operator, but just in terms of modality. But if you need software customization, then you get software customization rather than money for software customization. And that's basically wrapping up the openIMIS Catalytic Implementation Fund as well. Here's some links on where you can find various aspects of openIMIS. We'll have links right after this. You can contact us directly for those interested. We also now have a new colleague who is conversant in French as well. So if anyone has needs or scheme operators where French would be a preferred language of communication, we are very happy to interact in French as well. So please do reach out. The links are here, and if there are any questions to us or the wider GIZ team is also here. We have some implementers from Nepal who have experiences in implementing the software in Nepal. So if you have any questions, I think we are very well equipped to answer them now. Thank you.
Thank you, Sir Saraf and Ms. Constance. So to all our participants, if you have questions, you may type them in the chat box. Or if you wish to ask through your microphone, please raise your hand so we can unmute you.
Hi, Saurabh. This is Alvin. Thank you for the presentation. Do you have any preference for parts of Asia or specific countries, or this is accessible to any country as long as you're in Asia? Over.
It's accessible to any country in general. So this is the implementation fund is for Asia and beyond. While we yeah, it's global, and we don't want to really limited, saying like these would be the categories of countries that would be eligible, but we encourage anyone interested to get in touch with us, and we will work through the application together, right? So it is not GIZ. Please don't take the implementation, the openIMIS coordination desk or GIZ as a decision making body. We are here to support you in your efforts to secure funding from the Catalytic Implementation Fund, as that decision would be made by BMZ and STC, the donors to this. But please, if you're interested, please do get in touch with us. We will work with you to make sure that your application is strong, and we try to get you the resources that you need for a successful implementation.
Thank you, Sir Saraf and Dr. Alvin. We have a question from Dr. Jens. Dr. Jens, would you like to use your microphone? We have enabled the microphones of the participants.
Can you hear me?
Yes, doctor.
Yes.
Okay. Yes, maybe you already see my question in the chat. In my experience, in a way, before you start the selection of a specific software product, you will start with a more general IT needs assessment. So what are the IT needs of the organization? Where do you stand? What is the current situation? Which processes are already covered by IT? Which systems are in use? Where is the greatest need? Where is the greatest scope for improvement? And normally I would do that before then starting with a specific product. Now my question is, would you support an institutions in answering these kinds of questions, in working on these strategic issues? Could that be part of the feasibility study, or would it be a separate activity?
Thank you for the question. It's really interesting because, and I fully understand the point of view. I think for us, the feasibility study would cover parts of that, right? So it would be difficult to use the Catalytic Implementation Fund resources in the to basically get a full understanding of the IT needs, and ultimately getting to a stage where we come up with a requirement that just doesn't fit an openIMIS use case at all. So if there is some work that has already been put in, and I think we will be able to look into that from the very initial EOI that is submitted, and during this pre-feasibility where our teams would engage with the local team. So I think if there's some idea of the IT needs, then the feasibility study can really help to concretize those needs, and then look into what it would cost for an openIMIS implementation. And it could be that it costs much more than expected, but I think that that would be a scenario where it would work. But if like an agency is at complete, it has just been set up or is in the process of being set up for, and I take the example of health financing right now. So let's say a new national payer organization has just been set up, and they're still thinking through even their organizational structure, and would want to use the feasibility study to even help start the processes of thinking in IT. It might be a more difficult sell to the donors from our side. But if there is some activity already going on where there's a broad understanding of the IT needs, and just some sharpening of those ideas are required through the feasibility study, I think that can easily be supported. I hope that answers it. I didn't give a very clear yes or no answer, but it's somewhere in the gray area.
So I take it makes sense to discuss with you directly if there is a specific case.
Yes, that would be that would be the best way. But I wouldn't say it's a complete no.
Okay.
It depends on the use case.
Okay, thanks.
Thank you, Sir Sarab and Dr. Jens. Are there other questions from our participants? Microphones are enabled. You can ask your questions.
I have a question. Is there a limitation to the number per country, as in one per country, or there can be several successful candidates per country, Saurabh?
Constanza, we don't have a limit, right, for per country?
No, we didn't really think of that yet. So
Yeah.
I mean, this is
Okay, thank you, Constanza.
again, if there would you're talking about the different scheme operators, so to say, applying. If there, of course, ideally could be even links then between different schemes. That would be also a nice outlook. But yeah, it's not on the numbers.
Okay, thank you,
there's no limit.
Constanza.
Mhm.
Thank you.
I guess there are no more questions from our participants. So we will be sharing the recording of the session as well as the presentation slides once they're available. And if you have questions, please feel free to reach out to us so we can connect with the team. I guess Dr. Alvin can wrap up the session.
Thank you very much, Cha, Saurabh, Constanza. I hope that we can share this recording widely to the other people in the network and other networks, especially the network of networks in the other regions, so we can get more interest from other countries aside from Asia. So thank you. Good night, everyone.
Thank a lot.
Thank you.
Thank
Thank you.
you.
Bye.
Bye-bye.